Hello, I'm Mabel Jong. Thanks for watching. Agile Network Management. Heard of it? Well, perhaps you soon will. I'm here now with Sam Muppala of McKesson Health Solutions, and he's going to describe what it is and why we may hear more about it. Sam?
Thank you, Mabel, and hello everybody. As every one of you gets an insurance card, behind that insurance card is a network of providers, right? Essentially, when you get an insurance card from your employer, you get a promise of them covering services. So you get some benefits, and they cover that services, and you go to a network of physicians and hospitals to get the medical services. So really, network management or agile network management is really about how do you make sure that the network is designed in a way so you can get the most optimal experience, both from a cost perspective as well as the care perspective. So how can you generate the right outcomes at a sustainable cost? So really, agile network management is all about the science of doing that.
Okay. Why does it have to be a science and that doesn't happen organically, or what is preventing that from happening in our system today?
So when you think about what goes into design of a good network, you have to take some of the things into consideration. The first thing is, what product is this network serving? Which means what kind of benefits, what kind of medical services are going to be captured by the product serving that. So first, that's the first piece you need to look at. Then you need to look at what geographic areas is the population coming from, right? So you need to understand the access of the members to the providers, and that informs network design as well. And then the third thing you have to look at is, what is the health of the population this network is serving? What is their epidemiology? What kind of diseases are they likely to have? What can we do to prevent them from having diseases? What can we do to them so that the disease doesn't progress? All of those key things go into the design of a network. Right? It is trying to make sure you're putting the providers in your network who have these capabilities and can create the outcomes you need for them.
Mm-hmm. And are you finding that people are accepting that this needs to happen and moving towards that?
Absolutely. Health plans have been designing networks for a while. What we are talking about is really taking the technology behind the design and making it a lot more automated. So all of the things I talked to you about, looking at the product, looking at the access, looking at the epidemiology, how do you do all that in a simplified fashion? And what we're really talking about now is really creating technology to help with that. Mm-hmm. And it's becoming a lot more important as you think through what's happening with the different parts of a payer's business. So if you're thinking through the individual business growing because of health exchanges, or if you're thinking through the increased competition in the ASO business, or you're thinking through the profitability of the fully insured business, all of these things are dictating that you have higher performing networks, and that's what is driving the interest in this space.
So you believe, despite all of the other healthcare concerns and priorities out there, that this will rise to the top?
Absolutely, because if you look at it, it's fundamental to the product a health insurance company offers. And how you design a network is fundamental to whether you're going to bend the healthcare cost curve or not. So these are really dealing with some very, very key and fundamental issues for a health plan. So we see this as very much something which has a mind share of a health plan, because it is their differentiator. So when a health plan competes for business, for that of a large employer, one of the things they would like to show off to the employer is, why is it that their network is the best suited to serve them? Why is it that it is not going to create any kind of disruption for their members, mm-hmm. and that is going to take care of the health of their members?
Okay. Thanks for joining us, Sam.
Thank you.
I'm Mabel Jong. Thanks for watching.